welcome back to the DSS Break. And for those of you joining us for the first time, welcome. I'm Anna Annison, the founder of Data Science Salon, and I'm streaming directly from our headquarters, which is beautifully located here in the heart of Miami, just a few blocks from the iconic design district. And I'm here almost every week. We try to do it every week to discuss the world of data science, AI, machine learning, and we chat about unique experiences and best practices with leading data professionals in a quick 15-minute break. And today, I'm really excited to welcome Mugdha Tasgaonkar, who's a healthcare data science leader at Medtronic with over 13 years of experience in integrating AI, predictive analytics, and digital transformation into healthcare operation. Mugdha's work involves crafting personalized interventions using data from wearable devices, health apps, and electronic health records to improve mental health management, which is super awesome and important. Thank you so much for joining us today, Mugdha, to explore how these technologies not only simplify care for individuals, but also empower caregivers with actionable insights, significantly enhancing support systems and fostering greater independence, which, as I said, I feel like it's life-changing for a lot of people. It's really great to have you here.
Yeah, thanks, Anna. Thanks for having me. It's a pleasure to be here.
No, great. I'm so excited to dive in. But before we get into all the details about your work, I would like to just know a little bit about your journey and what got you interested in this space in the first place. Because, there's not a lot of women here.
Yeah, good. Yeah, thanks for asking that question. It is an interesting journey. And my journey into data science has been a blend of curiosity, problem solving, and a little bit of serendipity. I began my career in the banking industry, working on data management, ETL processes, analytics. And that's when I first realized how powerful data could be, not just as numbers, but as a tool to drive efficiency and improvements. After completing my master's in data science, I moved to Medtronic, where I had the chance to work with patient data. And Anna, it was here that I truly saw how data driven solutions a tangible impact could have, helping to improve patient outcomes and make smarter decisions in healthcare. What really kept me engaged was the intersection of technology and real world impact. That's very important. I was drawn to how data could uncover hidden patterns, tell story, and ultimately drive change. Over the years, I have worked on variety of projects from AI-driven models for detecting heart conditions to market strategies that help businesses grow. And now, as a leader in this space, my focus is on helping teams and organizations unlock the full potential of data for innovation, whether it's mentoring others, driving digital transformation, or building AI solution. I find the most fulfillment in turning complex data into actionable insights that truly create value.
Cool. No, that's a great journey. Thank you so much for sharing. And let's dive right in. The whole gritty topic of this. And I think the first question I'm going to ask you, what are kind of the current leading AI technologies and apps in the mental healthcare for neurodivergent communities across the healthcare industry? Because I think a lot of us, I don't know anything about this. So I think that would be very helpful to understand maybe if some of those apps are familiar and how are they solving the problem?
Yeah, thank you for these insightful questions. Over the past few months, I have dwelled into the potential of AI support neurodivergent communities in the mental health space. Although there's still much to be done, it's still new. AI is still getting into there. I have identified some key areas where AI is already making a difference. There are a few I would like to mention it here. We have got AI powered chatbots like WeBot Health and Visa, which provide emotional health support and stress management. This making mental health care more accessible. AI for early detection, and this is my favorite, AI for early detection, like Cognoa, is helping with autism diagnosis, while tools like Talia's Predictix are personalizing mental health treatment by using behavioral and genetic data. I am particularly excited about wearable AI devices because my research in that area. But there are devices like Empatica and BioBeats, which track physiological signals like heart rate and to predict anxiety episodes. Then there's Apollo Neuro, a device that uses neurofeedback to reduce stress. Again, I haven't used those tools yet, but those are there in the market. But I don't know how the usage is. Uh, on there, like there are a couple of others, like for personalized therapy, there is a Mind Strong. There is for ADHD, there's Akili Interactive and Otrobot. So these are the tools also help. I would also like to mention in terms of workplace and educational support, this is very important. There are a couple of tools like Utter.ai for note making and Microsoft's AI that enhances accessibility for neurodivergent individuals. These technologies are really starting to transform how we think about mental health care, making it more personalized and accessible for neurodivergent individuals.
No, that's really cool. No, thank you so much for sharing all those tools. And you also ended up sharing the use cases too. So I feel like you answered two questions in one. But it seems like there's a lot of other use cases probably that haven't been solved yet either, or there's no technologies, and there's probably a lot of opportunity, what I can imagine, for new tech, right? But the next question I'm going to ask is, what about the challenges, though, about AI-driven mental health solutions and really scaling them across the different healthcare systems? Because I can imagine there's a lot of, security, privacy, like things like that, and there's probably a lot of just people are scared to implement new technologies.
Yeah, that's a really good question. And I think this is the most important question whenever it comes to developing AI solutions. Um, AI has the power to transfer mental health care, but scaling these solutions across different healthcare system is no easy task. We are not just dealing with technology, we are also navigating regulations, ethics, trust, and accessibility. And working in healthcare industry and dealing with patient data, I can talk about this question for like all day, but I will focus on only key things here. First, regulatory hurdles slow things down. Every country has different laws, HIPAA in the US, GDPR in the Europe, and getting approval can take years. Then there's the challenge of data privacy. Mental health data is deeply personal, and securing it while training AI model is a constant battle against cybersecurity threat. Another issue or challenge I would like to address is bias. If AI isn't trained on diverse population, it can reinforce existing healthcare disparities. And let's be honest, many clinicians and patients are skeptical. Even I am skeptical whenever I'm using any mental health care app. So mental health is built on trust and human connection, and AI must complement, not replace, human therapists. Infrastructure is also another roadblock. High costs, lack of internet access, outdated healthcare systems make implementation tough, especially in low resource areas. Plus, AI needs to integrate smoothly with existing EHR, telehealth platforms. It's something easier said than done. And finally, AI isn't a set it and forget kind of a tool. It needs constant updates, oversight, and human involvement to ensure ethical and reliable care. At the end of the day, AI can be a game changer in mental health, but only if we address these challenges thoughtfully, ensuring solutions are accessible, ethical, and truly beneficial for everyone.
Yeah, no, that's a great answer. And, I think you talked a little bit about bias, and that goes into the next question about the accuracy of these, models, and the real, like how reliable are they, when it's really dealing with this kind of sensitive mental health data.
Yeah, and I can only talk about my experience. AI is still new. It's been there since long time. It has different terminology, but it's still new when it comes to LLMs and having real time applications for mental health. So when it comes to mental health, accuracy and trust are everything. AI has the potential to transform care for neurodivergent individuals, but we must build it responsibly. First of all, AI models need high quality and diverse data because mental health isn't one size fits all. Every human is different, they react to different things differently. So, we also need rigorous clinical validation and regulatory oversight to ensure safety. But beyond technology, human oversight is key. AI should support mental health professionals, not replace them. And this is very, very important. It must be explainable, transparent, and ethically designed to avoid bias and misinformation. And let's not forget real world impact. Continuous monitoring ensures AI improves over time, while crisis safeguards make sure the right help reaches those in need. At the end, AI should empower individuals and professionals alike, offering personalized, reliable, and ethical support when it matters the most.
Yeah, no, that's a great answer too, because I think that's a big thing, that misconception of AI replacing individuals. And I think in healthcare, that's definitely highly unlikely to happen, right? Because
Yeah.
it's just not safe, to do that. And
Yeah.
I think, maybe we could talk a little bit about some other, like, ethical considerations that developers would consider when they're actually, keeping in mind when they're designing these tools. What do you like, because that's like a big thing, I guess, when you're actually developing this. Is it now, it must be much different the way you look at it, that there is AI involved, right?
Mhm. Oh yeah, ethical considerations are very important. Again, coming from healthcare industry, ethical considerations are very important. Focusing on protecting data is important. So when designing AI tools for neurodivergent population, there are a few key ethical points to consider, and they are very important. Privacy. Privacy is crucial. Sensitive health data must be protected with strong security measures and clear consent processes. Bias, we talked about bias, is a big concern. Informed consent, transparency is vital. Users need to fully understand how AI works and how it collects the data. Another key point is accountability. Accountability is also important. AI should support human judgment, not replace it. Another one, users must also retain control over their data, what to share, what they are sharing, how it will be utilized or used in other part of applications or businesses. And lastly, AI tool must be accessible and inclusive, designed to meet the needs of individuals regardless of their specific challenges. And this is very important when it comes to neurodivergent population. By keeping these consideration in mind, and I think we can create AI tools that are safe, fair, and really beneficial for, especially for neurodivergent communities.
Yeah, no, that's a great answer again. And I think, yeah, you touched on a lot of different things that are very important to consider. And I feel like, yeah, I mean, I think we'll be moving forward to where people will really have to understand what the data actually is used for. Maybe they'll be more willing to share it, right?
Mhm.
If it can help them, right? So, but I think now that we're coming towards the end of the conversation, what advancements do you really, I mean, we talked about chatbots, we talked about a few different things, but what do you really think is going to be the most significant for these communities?
Um, Yeah, it's a very good question. I have interviewed so many families and got a feedback from there. And I have few key things that will have more impact or more need for neurodivergent communities are like my first thing is looking forward. There are few key trends in AI and machine learning that believe will really make a difference in mental health care. And again, this is completely based on what I have observed, what I have experienced, and the feedback that I got from these families. So first one is personalized treatment plans. This will become more common, and AI will be able to analyze person's unique data like their genetics, behavior, environments, and create treatment plans that are truly tailored to them. This could lead to more effective care and faster recovery. Next one is early detection. And this is my favorite because my research in this area, AI will certainly help with early detection of mental health conditions. We are already seeing AI models that can analyze things like speech patterns, facial expressions to identify early signs of issues like depression, anxiety, even autism. Catching these things early means we can intervene sooner and potentially improve outcomes. Then we have virtual therapists and chatbots. We are already using those. Predictive analytics is also a big trend. We are already using it. We are also seeing big progress with brain computer interface. It will take some time, but this will allow people to interact with technology using just their brain activity. This could be a game changer for individuals with severe communication challenges, offering new ways to manage their mental health. And finally, wearable powered by AI. So, wearable devices. Again, this is also my research area. So, I would like to see more advanced technologies coming into these areas. These devices can track things like heart rate, stress levels in real time, providing valuable insights into someone's mental health. These trends are all point toward future where mental health care is more personalized, proactive, and accessible, leading to better outcomes for patients or people like us. So I'm very excited about the apps like wearable devices where I can track my stress level.
Yes, me too. I like that. Yeah, that's
And I can give it to my husband.
yeah, that's the one I definitely need. Or if you have a recommendation, definitely send it our way
Yeah,
and we'll share it. But
sure.
no, it was really great to chat with you, Magda. I'm really excited to actually meet you in person in a couple of weeks because
Mhm.
you're going to be speaking about this topic in person. We're going to be at Oracle. You're going to be speaking on the 19th of February, which is just in a couple of weeks. I can't believe it. So,
Yeah.
um, and you had a great meetup yesterday too, I heard. So thank you so much
Yeah.
for hosting that and taping that. It's a great presentation, again, discussion. So,
Mhm.
and everybody, thank you so much for tuning in today. And if you guys can make it to Austin, hope to see you there. And if not, we will see you online and we'll see you in our community. And have a wonderful rest of the week.
Thanks, Anna. See you soon.
Bye.
Yep. Bye.